Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Voice disorders. Introduction. Your voice is the sound that you make when you speak, yell, or sing. Voice disorders are conditions that cause damage to your vocal cords, which can affect the way you sound and speak. Voice disorders can make it hard to communicate. They may cause pain. Sometimes, a voice disorder could be a sign of a bigger problem. This program explains voice disorders. It talks about common voice disorders, their symptoms, and how they can be treated. Anatomy. The throat is a hollow tube that starts behind the nose. It ends at the top of the trachea, or windpipe, and the esophagus. The esophagus is the feeding tube. The throat carries food from the mouth to the esophagus. The esophagus takes food to the stomach. The throat also carries air to the trachea and the vocal cords. The throat contains two vocal cords. They are located between the base of the tongue and the trachea. The vocal cords vibrate and make sound when air moves against them. The sound echoes through the throat, mouth, and nose to make a person's voice. General symptoms. Voice disorders affect the way you speak and sound. They often cause changes in the quality of your voice. A voice disorder may make it hard for you to speak at all. Common symptoms of voice disorders include a low or raspy voice, being unable to sing, difficulty speaking, hoarseness, itchy throat. These symptoms usually last longer than 2 to 3 weeks. Voice disorders can sometimes cause a cough. You may feel the need to clear your throat often. It may be hard to swallow. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Laryngitis. Laryngitis is the inflammation of the vocal cords. It is one of the most common voice disorders. Laryngitis can cause a weak or hoarse voice. It may cause a dry or painful throat. Your throat may tickle, itch, or feel raw. Laryngitis can also cause a cough. There are two kinds of laryngitis, acute and chronic. Acute laryngitis usually lasts 1 to 2 weeks. It often gets better with treatment. Sometimes acute laryngitis does not need treatment. Acute laryngitis can be caused by viral infections, overusing your voice. Rarely, a bacterial infection can cause acute laryngitis. Chronic laryngitis lasts longer than 3 weeks. It is usually caused by irritants such as smoke, chemicals, and alcohol. Other causes of chronic laryngitis include aging, cancer treatment, gastroesophageal reflux disease or GERD, infection. Laryngitis is often diagnosed with a procedure called laryngoscopy. During laryngoscopy, your healthcare provider will use a small light and mirror to look at the back of your throat. Treatment for laryngitis often depends on its cause. Keeping your throat moist is important when treating laryngitis. Drink a lot of water and avoid alcohol and caffeine. Sucking on lozenges or chewing gum can also help keep your throat moist. Use a humidifier to keep the air around you moist. Try to rest your voice whenever possible. Avoid singing, shouting, or talking for long periods of time. Try to avoid exposure to harmful chemicals and smoke. Wear proper protection and face masks if your job requires you to handle harmful irritants. If you smoke, quit smoking. Sometimes healthcare providers treat laryngitis with medications. Vocal cord paralysis. Vocal cord paralysis happens when the nerves and muscles that control the vocal cords do not work correctly. These problems stop the vocal cords from moving and working. In addition to the common symptoms of voice disorders, vocal cord paralysis can cause difficulty breathing, loud breathing, trouble swallowing. The cause of vocal cord paralysis is often not known. Injury to the vocal cords, neck, or chest can cause vocal cord paralysis. The injury could happen during a traumatic event, such as a car crash or sports injury. It can sometimes happen during surgery. A tumor is an abnormal mass of tissue. Tumors in the skull, neck, and throat can sometimes cause vocal cord paralysis. Vocal cord paralysis also can be caused by viral infections. Some viral infections may harm the nerves around the vocal cords and affect the voice. To diagnose vocal cord paralysis, your healthcare provider will ask about your medical history. They will perform a physical exam and may also perform a blood test. Your healthcare provider may perform a test called laryngeal electromyography, or LEMG. During LEMG, your healthcare provider will measure electric currents through your vocal cords with small needles in the skin of your neck. Vocal cord paralysis is often treated with voice therapy. Voice therapy is special training to help improve your ability to speak and breathe. Surgery is sometimes needed to repair the vocal cords. This surgery can improve your ability to speak, breathe, and swallow. Vocal cord lesions. Vocal cord lesions are abnormal growths on the vocal cords. They are usually caused by overuse. Common vocal cord lesions include nodules, polyps, cysts. Nodules are small growths on the vocal cords. They are usually hard and rough. They can cause a hoarse voice, neck pain, and pain in the ears. Polyps are swollen bumps that form on the vocal cords, but they are softer and more blister-like than nodules. Cysts are firm growths within a membrane or sac. Cyst sizes vary. In addition to the common symptoms of voice disorders, vocal cord lesions can cause a voice that breaks when you speak in sentences, a voice that gets tired easily, problems starting speech. To diagnose vocal cord lesions, your healthcare provider will ask you about your medical history. He or she will perform a physical exam. Vocal cord lesions are often diagnosed with laryngoscopy. Vocal cord lesions are often treated with voice rest and voice therapy. Surgery is sometimes needed to remove the growths.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Your voice is the sound that is made when air passes through your larynx and vocal cords. Voice disorders are conditions that cause damage to your vocal cords, which can affect the way you sound and speak. Common symptoms of voice disorders include a low or raspy voice, being unable to sing, difficulty speaking, hoarseness, itchy throat. These symptoms usually last longer than 2 to 3 weeks. Laryngitis is the inflammation of the vocal cords. It is one of the most common voice disorders. Laryngitis can cause a weak or hoarse voice. It may cause a dry or painful throat. Your throat may tickle, itch, or feel raw. Laryngitis can also cause a cough. Vocal cord paralysis happens when the nerves and muscles that control the vocal cords do not work correctly. These problems stop the vocal cords from moving and working. Vocal cord lesions are abnormal growths on the vocal cords. They are usually caused by overuse. Common vocal cord lesions include nodules, polyps, cysts. Voice disorders are often treated with voice rest and voice therapy. Sometimes surgery is needed. Thank you for using Explain.